Hello, good evening, everyone, to iMumz Ask Me Anything session. We are back with another Ask Me Anything session, and we have a very young and dynamic Dr. Aarti Chitkara with us. Welcome, Dr. Aarti ji, to iMumz Ask Me Anything session.
Thank you. Thank you, Mr. Ravi.
So, before we start, I would like to introduce Dr. Aarti ji with all of you. So, Dr. Aarti ji is a graduate. She did her post-graduation from the prestigious PGMER Medical College of Chandigarh, and she's also a silver medalist there. She's a very active member of various national and international societies like FOGSI, ACOG, and ACSO. She's also a meditator, and she has also won many awards in her career. So today she's going to talk about everything about gestational diabetes, how to stay away from gestational diabetes, and what precautions should follow once if you have gestational diabetes. And also she's going to talk about a little more about meditation, why it is important. And we have surprise, as we just told you, there is a live meditation session for you from 6:10 p.m. to 6:20 p.m. And then Dr. Aarti will take all your questions. So please post your questions in the comment box below. And over to you, Dr. Aarti. Please educate us on the topic of gestational diabetes.
Thank you, Mr. Ravi, for that kind introduction. Without wasting much time, I would like to start straight away with the topic because we have to include the meditation as well. So here, I don't want to bombard the pregnant woman with a lot of questions and a lot of medical jargons. And we will like to keep a holistic approach, which includes meditation, diet, lifestyle, nutrition, and other things also. So I can totally understand the feelings that surround pregnancy, that is excitement, anxiety, and hope, which often gives rise to many questions. And iMumz is a really brilliant platform that brings all the pregnant women across with the best of the gynecologists across the country so that you can get all your queries solved on just this single platform. And I'm really thankful for them to have made me give this opportunity where I can speak and solve all your queries as much as I can through my experience and my knowledge. So I'll be addressing a few questions. My topic will go in a few question series like, what is gestational diabetes? Some people have this doubt, why didn't I have diabetes before pregnancy? How pregnancy made me have diabetes? Will GDM affect? Gestational diabetes is called as GDM. So I'll be talking this short form only throughout my talk. Will GDM affect my baby? Will I have GDM after I have my baby? What should I do if I have been diagnosed with GDM? What are the signs or the symptoms that I can recognize myself when I'm pregnant that can give me suspicions that I might be having GDM? So we'll be talking about these small things. First of all, as pregnancy is a very beautiful experience, through next 1 hour, I'll be sharing your journey through this beautiful experience of pregnancy. First, I'll talk about a little about how the glucose is metabolized in the body. See, what happens is the moment we eat food, जैसे हमने खाना खाया, हमारा intestine उस खाने को तोड़ता है छोटे particles में. जो सबसे छोटा particle होता है वो glucose. वो जाएगा हमारे blood stream में. It gets absorbed blood में. फिर इंसुलिन सडनली एकदम से रिलीज होता है. पैंक्रियास एक हमारा एंडोक्राइन ऑर्गन है विच रिलीजेस इंसुलिन. ये इंसुलिन और ग्लूकोज दे मेंटेन अ वेरी गुड बैलेंस. सो इंसुलिन ज्यादा बढ़ने नहीं देगा ग्लूकोज को. वो क्या करता है, हमारे सेल्स को बेसिकली एनर्जी चाहिए होती है, वो चाहिए होती है ग्लूकोज के फॉर्म में. इंसुलिन क्या करेगा, जो हमारे सेल्स के ऊपर जो दरवाजा बना होता है विच इज कॉल्ड एज रिसेप्टर, इंसुलिन ग्लूकोज को उस दरवाजे के थ्रू सेल्स के अंदर भेज देता है सो दैट हमारे बॉडी के सेल्स उस ग्लूकोज को एनर्जी को यूटिलाइज कर सके और अपना काम कर सके. अब प्रेगनेंसी में क्या चीज थोड़ी सी डिफरेंट होती है इसमें, मदर को भी ग्लूकोज चाहिए, बेबी को भी ग्लूकोज चाहिए. मदर बेबी को ग्लूकोज थ्रू प्लेसेंटा प्रोवाइड करेगी. एज वी ऑल नो, मदर्स आर द मोस्ट सेल्फलेस बीइंग्स ऑन अर्थ. प्रेगनेंसी भी हमारी बॉडी को उसी तरह ट्रीट करती है एंड इट मेक्स सो सेल्फलेस कि जो भी ग्लूकोज या फिर खाना मदर इज ईटिंग वो सारा ट्राई करती है कि जितना मैक्सिमम ग्लूकोज बेबी को थ्रू प्लेसेंटा सप्लाई कर सके. तो प्रेगनेंसी इज कॉल्ड एज अ स्टेट ऑफ फास्टिंग हाइपोग्लाइसीमिया. मतलब जब हम सुबह खाली पेट होते हैं तब हमारे ग्लूकोज लेवल्स काफी कम होते हैं, नॉर्मल से थोड़े कम होंगे, हाइपोग्लाइसीमिया जिसको बोलते हैं, लो. एंड पोस्ट प्रैंडियल हाइपरग्लाइसीमिया, खाना खाने के इमीडिएटली बाद ग्लूकोज लेवल थोड़े ज्यादा शूट अप होते हैं. ये क्यों होता है? बिकॉज बॉडी वांट्स व्हेन इन प्रेगनेंसी जो प्लेसेंटा के थ्रू हार्मोन्स रिलीज होते हैं, HPL, इंसुलिन, कॉर्टिसोल लेवल्स, they try to मैक्सिमाइज जो हमारे बॉडी, जो मदर खाना खा रही है, वो ज्यादा से ज्यादा उसमें से ग्लूकोज फर्स्ट लेवल पे, प्रायोरिटी लेवल पे बेबी के पास जाए, देन द मदर्स बॉडी स्टार्ट्स टू यूटिलाइज इट. अब GDM क्यों हो? दिस इज द नॉर्मल फिजियोलॉजी ऑफ हाउ ग्लूकोज इज मेटाबोलाइज्ड इन आवर बॉडी, नॉर्मल ह्यूमन बीइंग में, प्रेगनेंसी में. अब GDM क्यों होता है? प्रेगनेंसी इज अ स्टेट ऑफ इंसुलिन रेजिस्टेंस. मतलब हमारी बॉडी में जो इंसुलिन नॉर्मल काम कर रहा था, वो दरवाजे के ऊपर धक्का मार के ग्लूकोज को अंदर भेजने का, वहां पे थोड़ा सा एक स्लाइट लेवल ऑफ रेजिस्टेंस आता है, व्हिच इज कॉल्ड एज इंसुलिन रेजिस्टेंस. अब कोई भी चीज, प्रेगनेंसी इज नॉट अ डिजीज, इट इज नॉट अ पैथोलॉजी, इट इज अ फिजियोलॉजिकल स्टेट. कुछ प्रॉब्लम्स प्रेगनेंसी में इसलिए आ जाती है जब वो फिजियोलॉजिकल स्टेट एग्जैजरेट हो जाती है. तो इंसुलिन रेजिस्टेंस तो ऑलरेडी प्रेगनेंसी का पार्ट है. अब GDM क्यों हो रहा है? कुछ लोगों में वो रेजिस्टेंस, इंसुलिन रेजिस्टेंस ओवर एंड अबव होता है, व्हिच इज मोर देन द फिजियोलॉजिकल लेवल. दैट कॉजेज GDM. Also, there are certain high risk factors because आजकल people delay their pregnancies, old age pregnancies देखने मिल रही हैं, PCOD इतना ज्यादा prevalent है, IVF है, people go for multiple stimulated cycles. So these all somehow predispose obesity, lifestyle, our lifestyles are not very good. So these all predispose to metabolic problems. हमारे body में जो normal metabolism है, उसके अलावा थोड़ा metabolic changes ज्यादा होते हैं. That is the reason why GDM is getting increased in these pregnancies. So India में इसका prevalence 5 to 20% of pregnancies में देखा गया. And there is another some set of women who are already diabetic and entering pregnancy. That we'll deal separately. Today we are going to stick to GDM because it itself is a vast topic. So this was about the basic physiology. Now we'll see कि how does GDM is going to affect your baby or not? ये बहुत लोगों को question होता है. Usually baby के body parts first 8 weeks में जो embryogenesis का period होता है तब बन जाते हैं. GDM जो insulin resistance होता है that comes little later in the pregnancy, which is around the second trimester. मतलब 24 to 28 weeks के around maximum insulin resistance होता है हमारे body में. उस time पे हमारे blood glucose levels ज़्यादा shoot up और ज़्यादा shoot down करते हैं. वो इतना ज्यादा ऑर्गेनोजेनेसिस को अफेक्ट नहीं करता. तो जो बनावटी नुक्स है वो होने के चांसेस नहीं होते बेबी में इन केसेस ऑफ GDM. बट अदर कॉम्प्लिकेशंस होने के चांसेस होते, स्टिल आर देयर. जैसे अब ये तो था मदर से रिलेटेड. नाउ वील टॉक सम चेंजेस एंड सम प्रेगनेंसी रिलेटेड कॉम्प्लिकेशंस जो बच्चों में होने के चांसेस है. जैसे बेबीज कैन हैव मैक्रोसोमिया. मैक्रोसोमिया का मतलब होता है बेबी इज ओवर एंड अबव द एवरेज स्टैंडर्ड वेट. जितना उसका वेट ग्रोथ होना चाहिए उससे कहीं ज्यादा वेट होता है. नंबर 1, दिस इज वेरी. कुछ बेबीज में कम चांसेस होते हैं कि फीटल ग्रोथ रेस्ट्रिक्शन हो जाए, मतलब वो जितना उनको वेट अटेन करना चाहिए उससे लोअर साइड पे रहते हैं. वो थोड़ा बिकॉज जो ऑलना होती है प्लेसेंटा वहां पे चेंजेस आते हैं, इस वजह से फीटल ग्रोथ रेस्ट्रिक्शन, लो वेट होने के चांसेस कम है एज कम्पेयर टू मैक्रोसोमिया. फिर बाकी जो कॉम्प्लिकेशंस होती हैं GDM एंड प्रेगनेंसी रिलेटेड वो बच्चे के पैदा होने के बाद होंगे. जैसे लो बर्थ वेट हो सकता है, प्री मैच्योर डिलीवरी होने के चांसेस होते हैं. सो दीज आर द अदर टाइप ऑफ कॉम्प्लिकेशंस. नाउ what the pregnant woman can do, number 1, to identify the signs and symptoms कि उसको GDM डेवलप हो रहा है, and secondly how she can prevent GDM, how she can treat GDM once she has been diagnosed. How to recognize the signs and symptoms? Number 1, your doctor should जब first antenatal visit पे your doctor should identify कि आप high risk category में fall करते हो तो आपके first antenatal visit पे ही GTT glucose tolerance test करवा लिया जाए. Then there are another set of patients who are normal antenatal. अब तो government of India and WHO have recommended कि universal screening होना ही चाहिए हर pregnant patient का. वो हम usually 24 to 28 weeks के window period पे कराते हैं. जो हाई रिस्क में फॉल करेंगे उनका फर्स्ट एंटीनेटल विजिट पे हो जाना चाहिए GTT टेस्ट. देन योर डॉक्टर विल टेल यू कि आप GDM आपका डायग्नोसिस बन गया है और यू फॉल अंडर नॉर्मल प्रेगनेंसी. वंस यू हैव बीन डायग्नोज्ड विद GDM, then you have to follow a certain set of dietary habits and also lifestyle habits. So your doctor will chart out with the consultation of a nutritionist how you have to modify your diet chart. So जो guidelines जो recommend करती हैं, you should have a multi-nutrition. Like you should have a proper proportion because carbohydrates कार्बोहाइड्रेट ग्लूकोज हमारे बॉडी को डैमेज कर रहा है, हमारे सेल्स में ज्यादा जाके प्रॉब्लम क्रिएट कर रहा है, पोस्टपैंडल हाइपरग्लाइसीमिया हो रहा है, मतलब कहीं इंसुलिन लेवल पे डिफेक्ट है, तो ग्लूकोज कार्बोहाइड्रेट से हमें प्रॉब्लम होने के चांसेस है। तो हमें हाई ग्लाइसेमिक इंडेक्स फूड्स नहीं खाने होते हैं ज्यादा, हमें नॉर्मोग्लाइसेमिक या लो ग्लाइसेमिक इंडेक्स मील्स लेने हैं। कार्बो हमारे पूरे दिन के जो मील है उसमें कार्बोहाइड्रेट का प्रोपोर्शन शुड बी 40%, फैट शुड बी 40%, प्रोटीन शुड बी 20%. This is how we split up your meal, and this should be done in consultation with a nutritionist. So through the iMumz app, I will be uploading a diet chart which was there in my institute. So this was the diet chart which we used to give to patients. And ये भी बोला जाता है कि you should give 3 major meals: breakfast, lunch, dinner, with your breakfast and lunch being heavier, dinner being slightly on the lower side. And more importantly, you should include 3 snacks. The snacks are very important for a patient with GDM. हमें शुगर बहुत ज्यादा शूट अप नहीं करानी है, लेकिन इतना स्टारवेशन नहीं होना चाहिए प्रेगनेंसी में कि वो हमारे बॉडी के सेल्स को तोड़ने लग जाए, कि एकदम हाइपोग्लाइसीमिया में चला जाए. यू शुड ऑलवेज रिमेंबर कि हाइपोग्लाइसीमिया एपिसोड्स आर मोर डेंजरस टू द बेबी दैन द हाइपरग्लाइसीमिया. बोथ आर डेंजरस, बट हाइपोग्लाइसीमिया इज इवन वर्स. तो स्टार्व नहीं करना है अपने आप को. This is very important. दूसरा, you should monitor self glucose levels. I will also provide you a self glucose monitoring chart. What we do is we write date on the side and timings. Fasting का blood glucose after breakfast, after lunch and after dinner. तो fasting का target should be always less than 95. Breakfast 1 hour after meal कर रहे हो तो 140 is the target. 2 hours after meal अपना self glucose check कर रहे हो, it should be 120 should be your target. These are the target levels. So you have to maintain a 1 week or a 2 weekly chart. घर पे खुद से self glucose monitoring करने के बाद take that chart to your doctor. He or she will review your diet chart and your self glucose monitoring chart and advise accordingly कि आपको insulin की जरूरत है या metformin जो भी oral टैबलेट्स ऐड करने की जरूरत है या फिर कोई एक्सरसाइज ऐड करने की जरूरत है. एंड वन मोर इम्पॉर्टेंट थिंग, डोंट सडनली स्टार्ट डूइंग एक्सरसाइजेस इफ यू आर डायग्नोज्ड विद जीडीएम. सोच के कि मैं एक्सरसाइज करूंगी तो शायद मेरा ग्लूकोज लेवल्स कंट्रोल आ जाए. दिस इज नॉट राइट. नंबर 1, कोई भी एक्सरसाइज स्टार्ट करने से पहले कंसल्ट योर डॉक्टर. यू माइट बी अ केस ऑफ प्लेसेंटा प्रीविया, यू माइट बी अ केस ऑफ थ्रेटन्ड अबॉर्शन, मिसकैरेज. सो एक्सरसाइज स्टार्ट करने से पहले यू शुड ऑलवेज कंसल्ट योर डॉक्टर, नंबर 1. And you should do only moderate kind of exercises. Don't go into heavy exercises during pregnancy. What do I mean by moderate exercises? Yes, तो हर कोई बोलेगा आपको, but you will not be able to judge कि कितना is good for me. So while doing an exercise, if you are not able to talk, not able to breathe, you're gasping for breath, that is a heavy level of exertion. If you are while doing a brisk walk for 30 minutes or a little bit of Zumba or swimming is considered to be best in pregnancy, but not many people do swimming in pregnancy in India. So you can choose according to your body type, according to your comfort level, and then go for it. बहुत ज़्यादा exertion is not advisable in pregnancy. So these are certain things about GDM. Next, I'll be addressing your questions. But before that, I would like to introduce Dr. Rachna ji as well. So we have this surprise for you because I feel that a medical line and medical treatment is incomplete if it is not a holistic approach. You should always have a mind, body, emotional balance. This is what WHO has also told the definition of health, which includes emotional and mental well-being as well. And we have seen when there is a lot of stress, depression is associated with diabetes in pregnancy. We have seen pregnant women getting into anxiety about how their baby will do. They are getting into depression. This also aggravates other kind of comorbidities like preeclampsia, hypertension होने के chances ज़्यादा होते हैं. We have a lot of stress. एक भी डिजीज अगर प्रेगनेंसी में आ गया, if you're diagnosed with XYZ problem in your pregnancy, that will add to your stress. उसकी वजह से एक और प्रॉब्लम आप ले लोगे साथ में. So only treating one particular disease or a problem is not right. I think we should go for a holistic approach, which will reduce the main problem, that is the stress level. If you keep it controlled, it will keep your blood sugars levels normal, your blood pressure levels normal. And I mean, myself being a meditator for last almost 8 to 10 years, I have really experienced a lot of changes in my life that keeps you balanced throughout. You keeps your hormone levels in check. So over to you, Dr. Rachna ji. She's a dental surgeon from Amritsar, and now she's practicing in Chandigarh as a senior consultant. She's also a senior art of living teacher, and the one who keeps pushing me into meditation. So I would like her to talk more about meditation and pregnancy. Over to you, Dr. Rachna ji.
Thank you, Dr. Aarti, for introducing me to this lovely group. I'm looking forward to, be with them. And thank you for telling us such a useful information about gestational diabetes here. And I'm sure a lot of people would, take that information and help their own conditions. So let's, do you want a live session? Let's go for a live meditation here. I think you will experience it. Yeah. And would be able to experience yourself and see how it changes your mood, how it changes your energy levels in the body. So first we do, well, let's start shaking our hands. Let's do little movement in the body. Shake your hands nicely, shake them, shake them, shake them. Have you seen a rag doll? कपड़े की गुड़िया देखी आपने? उसमें कोई बोन नहीं होती ना, तो इस तरह से वो इस तरह से करती है ना, जब उसका हाथ हिलाते हैं तो इस तरह से अच्छी तरह शेक कर ले. Shake yourself nicely. आपकी उंगलियां गिरेंगी नहीं नीचे. This is for sure. अच्छा, राइट साइड पे कर ले थोड़ा सा, लेफ्ट साइड, ऊपर भी कर सकते हैं और नीचे भी. You can shake your legs also wherever you're sitting on a chair और जहां पे भी बैठे हैं थोड़ा सा leg shake कर ले. And just close your eyes. Now close your eyes and just feel that sensation, that buzz in the body, in your arms, in your shoulders, in your fingers. जो भी ये vibrations और buzz महसूस हो रही है उसे महसूस करते रहे, उसके प्रति सजग हो जाए. All the tension on the breath now. You can keep your eyes closed. आंखें बंद ही रखें और सांस पे सारा ध्यान रखें. Your breath is coming to normal. It's getting subtler and smoother. Take a normal breath in and let go. Another breath in and gently breathe out. Every incoming breath energizes the body, and every outgoing breath relaxes the body. सारा ध्यान सांस पर. Take another normal breath in and out. एक और गहरा लंबा सांस लें, एक स्माइल के साथ. Keep a gentle smile on the face. और सांस को जाने दें. अपने आसपास होने वाली सारी आवाजों को बड़े ध्यान से सुने. पंखे की आवाज हो, किसी के बोलने की आवाज हो, जो भी आवाज आपको सुनाई दे रही है उसे ध्यान से सुने और एक्सेप्ट कर लें. Accept all the noises around you. Now you are one with your environment. Take another normal breath in and gently let go. Now bring your attention to your right foot. अपने दाएं पैर पर अपना ध्यान ले जाएं. सिर्फ हल्का सा ध्यान लेके जाना है और उसको ढीला छोड़ दें. Right leg. Left foot. And left leg. Genitals and abdomen. जननेंद्रियां और पेट ढीला छोड़ते जाएं. Your chest. Relax your right shoulder and right arm. Relax your left shoulder and left arm. Your fingers, fingertips, relax them too. Relax your neck, your face. Relax your lips. If you smile, whole of the face is relaxed. Your nose, your cheeks, your eyes, eyeballs, everything is smiling. Every part is smiling. Relax your eyebrows too. Relax all the muscles of your forehead. माथे को बिल्कुल ढीला छोड़ दें. सिर को ढीला छोड़ दें. Your back, entire body, पूरा शरीर. Relax completely. विश्राम करते जाएं. पूर्णता विश्राम. Take another breath in and let go. अपने विचारों के प्रति सजग हो जाएं. Become aware of your thoughts. कैसे भी विचार हो, अच्छे या बुरे, जैसे भी हैं, उन्हें रोके नहीं, आने दें. विचार बादलों की तरह होते हैं, वो आते हैं और चले जाते हैं. You have become one with your thoughts now. Take another breath in and let go. Become aware of your feelings and sensations in the body. अपनी भावनाओं के प्रति सजग हो जाएं. They may be pleasant or unpleasant, सुखद या दुखद, जैसी भी हैं, उनके प्रति सजग हो जाएं. You are love. You are peace. आप ही प्रेम हैं और आप ही शांति. You are the beautiful gift of the divine. Om Shanti, Shanti, Shanti. Take another breath in and let go. एक और गहरा लंबा सांस लें और धीरे धीरे जाने दें. Become aware of your body. अपने शरीर के प्रति सजग हो जाएं. You can gently move your fingers and toes. हाथों पैरों की उंगलियों को धीरे धीरे हिलाएं और शरीर के प्रति सजग हो जाएं. अपने आसपास के वातावरण के प्रति सजग हो जाएं. Become aware of the environment around you. And as and when you feel like, you may open your eyes. धीरे धीरे अपनी आंखें खोल सकते हैं. Become aware of this peace and joy, that happiness, and the feeling of the space within you. I hope you're feeling very light, energetic, and relaxed. You can post your experiences here. See, meditation, just we did 10 minutes of meditation. You just close your eyes for 10 minutes, and within 10 minutes, see what profound effect it has on our entire system. Physically, you relax, mentally and emotionally, you relax. Dr. Aarti had described the benefits of meditation. So you'll be doing great good for yourself as well as your baby. You know, before he or she comes into this world, you'll be introducing the baby to the meditation. You'll be relaxing yourself as well as your baby. It will help in the growth, development, emotional growth, nervous system of the baby to soothe, as well as yours. You have so many emotional upheavals during pregnancy, isn't it? So many cravings and aversions. Craving for the food is most common. So as the gestational diabetes has been described by Dr. Aarti, it will really help you control your cravings, isn't it? और हमारे बड़े बुजुर्ग कहते थे usually कि जब प्रेगनेंसी में बच्चे की अच्छी ग्रोथ के लिए और माँ के लिए दोनों के लिए कुछ स्पिरिचुअल प्रैक्टिसेस करना बहुत जरूरी है. लिसन टू सम सूदिंग म्यूजिक और द चैंट्स, और देखना भी कहते थे ना कि अच्छी पिक्चर्स लगा के रखो सो दैट उसका इफेक्ट बेबी पे हो. सो दे आल्सो न्यू दैट देयर इज अ डीप कनेक्शन बिटवीन द मदर एंड द बेबी एंड हाउ द मदर कंडक्ट्स हरसेल्फ. You know how the sense organs are, what are you watching, what are you hearing, what are you tasting, everything has an effect on the baby. You know? So through meditation you can bring that change to your baby himself or herself, along with benefits for your own. Over to you, Dr. Aarti.
Dr. Rachna, we kind of session. We thoroughly enjoyed this. And there's a question where they're asking ki meditation is excellent for pregnancy. What is the best time and the best place for pregnant women to do meditation?
See, usually the best time for meditation is the sunrise and the sunset time. They say that time the mind settles down very easily. But it's okay, whenever you can meditate, it is the best time for you. You know, so you can meditate maybe before meals. Every meal, you can meditate before every meal, maybe before breakfast or before lunch and before dinner, because we recommend that the stomach should be light when you meditate. Then your mind will settle down more easily into meditation.
Absolutely true.
So if I think you would be more knowing more about the responses and the questions regarding meditation, if there are, we can always hold another session for them, especially for the app users, to learn meditation. This was a guided meditation. I guided you into meditation for 10 minutes, but you can learn it on your own also. So Dr. Aarti will maybe able to tell you in detail about these things. So you can always put your questions in the chat box and you can ask or share your experiences about the meditation. Over to you, Dr. Aarti.
Thank you so much.
So we can start up with the question and answer. Maybe we can guide these pregnant women more into meditation, and we can tell them how through this app we can get more meditation sessions for them. Maybe we can organize a Sehat Samadhi course also through the app. So we'll talk about that in detail along with the question and answer session. So Mr. Ravi, if you could guide us in the question and answer session.
Sure, doctor. Everyone, those who are interested in having a meditation session, we do organize meditation sessions regularly for the app users as well. So interested users can please message us and we'll probably have an advanced meditation session or something for you. Thank you so much, Dr. Rachana ji, again for this wonderful session. I think the questions have come down after this meditation sessions. Before that, the questions were popping, and suddenly after the meditation session, I don't see many questions here. So those questions which were there, let's start taking, Dr. Aarti ji.
That is the immediate effect we saw of meditation. So hopefully more pregnant women will start with meditations now. Yeah, please.
So the first question from Srinidhi, she is 34 weeks pregnant and she has cough, due to which there are some contractions. Which medicine should she use to avoid this condition?
Okay, so coughing, first of all, she should, it has to be decided how chronic cough she has. She should try to find out any underlying cause that she has for cough. If there is some kind of a thing which causes chronic irritation, some allergy that she has to certain things, number one is to avoid the cause of the cough. Secondly, if she still then she should try to have some kind of gargles and other conservative measures. Warm saline gargles are the best. Sometimes we give more weightage to taking medications and we avoid these basic things. So that should not be done. The basic things like gargling is very important, thrice a day with warm saline gargles. And then she can take some cough syrups, which contains antihistaminics. Tuscu she can take, and yeah, I think that's it. And then antihistaminics. If it is too much, which is causing her a lot of disturbance, then at night maybe she can go for an anti-allergic like a fexofenadine, which is considered to be safe during pregnancy. It's a category C drug that she can take during nighttime.
Thank you so much, doctor. Akanksha is also thanking for the wonderful session, and Dr. Narendra ji and Dr. Jaydeep ji are also here live with us. They're also thanking you, Dr. Rachana, for the meditation session. Thank you so much for being there, Dr. Jaydeep ji and Dr. Narendra ji. Going ahead, next question is from Lakshmi Prasanna. She's 5 weeks pregnant. Her TSH levels are 3.10. She need any medication, she is asking.
So the subclinical hypothyroidism in pregnancy is a very debatable topic. It's a topic of controversy where there are different cutoff levels for everybody. This is also overlooked in pregnancy because of the varying guidelines. India follows different guidelines, different cutoff levels. The Americans follow different. The UK people follow different. So this condition usually goes undiagnosed and it can have implications on your babies. So what cutoff we follow in India for the first trimester is 2.5 for TSH, but you should, along with that, I would recommend you to get your free T3, free T4 levels check, number one. Then consult your doctor, your obstetrician again for this. And usual cutoff for TSH we take in first trimester in India is 2.5. You might need to start with a low dose of thyroxine supplements. Don't take an over-the-counter pill. Consult your doctor before that. get your levels checked. And according to your body weight, she will like to start you with some kind of thyroxine supplements. Probably the lowest dose, which is a 25 micrograms, should suffice for this. And then we follow up with further trimester-wise levels of TSH level.
So Dr. Jaydeep ji is asking any specific checks in pregnancy which pregnant mothers with diabetes should do?
Diabetic mothers in pregnancy, both ultrasound scans and the normal routine tests. Number one, they should get their urine routine examinations done. They are more predisposed to getting UTIs. Number one is urine routine microscopy examination. Secondly, urine albumin, sugar, and ketone levels can be done in every trimester. And they should keep their weights in check. Regular trimester-wise weight check is very mandatory because they have a tendency of going either excessive overweight gain, or they might not go for the sufficient weight gain. Excessive weight gain is more common with diabetic mothers, so weight check is very important. Next, their blood pressure levels should be checked because the diabetic pregnant women are more predisposed to developing preeclampsias. So that blood pressure levels have to be checked. And other than that, the pre-existing diabetic conditions who enter pregnancy, that is type 1, type 2 diabetic women who enter pregnancy, they should get their fetal echo is very important, along with level 2 ultrasounds, because they are more predisposed to developing congenital fetal malformations. And also there are more possibilities of uteroplacental insufficiency in these patients who are already diabetic and enter pregnancy. For them, we should get the color Dopplers to check the resistance levels in their umbilical vessels, and also start them on aspirin. The ones who are already diabetic, it's not recommended for GDM alone. So these are the few extra things that the diabetic patient should do.
Yeah, thank you so much, Doctor. Vaishali, I'm not ignoring anyone's question. I'm just taking questions in order. We have questions from inside the app as well as on the YouTube. So I'm taking questions on the timestamp order. So please wait for 3-4 more questions. I'll definitely take your question. Next question by Jasmeet Kaur. She's 7th month pregnant. Her body weight is 92.1, but the body water level is 7.3. How can she increase this level?
Body weight?
Weight is 92.1. Yeah. Jasmeet is 28th week pregnant. Her body weight is 92.1 kilogram. And her body water level, she mentioned, is low, 7.3, she mentioned. How can I increase that level, she's asking.
Body
water level?
I think this is on the higher side. She should get her BMI checked.
Okay. Maybe she's talking about AFI, doctor. 7.3, she's mentioning water level.
Okay, that is the amniotic fluid levels, which is the weight water around the baby. So are you, like, what is the underlying condition that you have? Like, are you type 1, type 2 diabetes or GDM? Or what is your blood pressure levels? These are 2-3 things that I want to know before making a comment. This is definitely a low water level. Also, I would want to know if you ever had any history of leaking through your vagina, because sometimes there might be small amount of leak, which is not like a water gush, and the pregnant patient does not usually realize. She might think that it's a normal water discharge. So I want to know if it is because of leakage, it has a different management. If it is because of your increased blood pressure or your underlying diabetic conditions, then it has a different management. So I would like to know a little more detail before making a comment.
Thank you, doctor. If you're watching this live, please mention more details, Jasmeet. So many of you like the guided meditation, so you can check out the baby care program of that. There are more than 25 different guided meditations which you can check out. So yeah, please subscribe to the baby care program and unlock more stories and more talk to the baby exercise and meditation inside your app. Going forward with the next question, Rajini. Her blood group is B negative and she's 7th month pregnant. Injection abhi lagwana hai kya ya after delivery?
Number one, what is your husband blood group, and did you get your ICT levels checked? And third question is this your first pregnancy or you already have a baby? See, anti-D is important. Number one, in Rh negative pregnancies, if your husband blood group is positive, your ICT is negative. That means your antibodies have not yet reached the baby. You should get an anti-D injection done at around 27-28 weeks is the ideal time. If your husband blood group is also negative, then there's not much of concern. Most likely the baby will be still negative, and then you might skip the anti-D injection. Mr. Ravi?
Yeah. Thank you so much, doctor. Next question by Vaishali. She is 6 weeks pregnant and have constipation before also. Was also taking some churnas, but now she cannot. Doctor advised Pixit syrup. Is it safe for regular usage?
Number one, for if you're having a chronic constipation, I would first, most important is lifestyle changes. I'm a person who stresses more on lifestyle changes first, then going for any kind of meditation. So first, you should increase your water intake. Anyways, during pregnancy, our body is in a state of excessive dehydration because of the fluid shifts that happen. So increase your water intake. Especially take more of lukewarm waters, don't take too much of cold water, and increase the fiber intake in your diet. We Indians really lack a lot of fiber in our diet. We think that we are eating a lot of fiber, but we do not. So 60 gram of dietary fiber is recommended daily, and in pregnancy you can increase it up to 80 to 100 grams a day also. Look for fiber rich diets. If you want, I can give you a list of the diets which are more fiber rich. The Indian foods which contain a lot of fibers, increase green leafy vegetables, raw fruits you can take, but make sure that you're washing them adequately. So these are the first 2-3 things which are very important. And the syrup you can take at bedtime with lukewarm water. Take 1 or 2 tablespoons with lukewarm water, if it is like really needed.
Thank you, doctor. Dr. Jaydeep is asking.
You can increase curd. If you have a good amount of lactobacilli in your intestine, that also reduces your constipation and it increases your overall gut health.
Thank you, doctor. Dr. Jaydeep ji is asking, if someone becomes diabetic in pregnancy, will they be diabetic throughout their life? If someone is diabetic in pregnancy, will they become diabetic throughout their life?
Okay, this is a very good question. So if you developed diabetes during pregnancy, so that means your body has some kind of tendency of insulin resistance is higher than the normal population. So there's a 40% increased risk over and above the normal that you might develop diabetes later on. So what we do is there is a postpartum follow-up schedule. That means for a normal person, we say that after every 3 years, you should get your sugar levels checked. If you've had a diabetes during pregnancy, that is, you had GDM, screening is recommended once a year for first 5 years. Then you can enter into normal screening, that is after 3 years. So for the first 5 years after pregnancy, every year you should get your blood sugar levels checked. Either an HbA1c level, which tells you the last 3 months of blood sugar control, or you can do a GTT. GTT is a little cumbersome, so you can get an HbA1c level checked every year.
Thank you, doctor.
Did Mrs. Jasmeet come up, the one who had 92 kg?
Not yet, doctor. No.
Okay.
Anushri has a question. She's 23 weeks pregnant and her TSH levels are high and doctor recommended Neurokind tablet. Is it good in pregnancy? Won't it affect baby? She's asking.
TSH levels high, how high? Neurokind is a kind of a multivitamin supplementation. Recently, WHO in July 2020 has only come up with huge guidelines on how much multivitamin micronutrients we should take. So according to WHO, they don't recommend a lot of multivitamin supplementations as such. So those we have to compensate through our diets. Number one, Neurokind is also kind of a multivitamin supplementation. If your TSH is very high, I don't know, you've not mentioned how high it is. If it is really high, you need to take thyroxine supplements. That is the one which is going to benefit you and your baby. Neurokind or kind of multivitamin supplementations, you may consider it if you wish to. Otherwise, there are no guidelines which say that you need to take multivitamins.
Thank you, doctor. Next question by Ayushi. She's 23 weeks pregnant. She's asking if she can use a hair removing cream.
How many weeks pregnant is she?
23 weeks pregnant.
Okay, hair removal creams are very topical things, so I think you can take. They don't get absorbed into your body. You can use them.
Lipsa's question, she's 15 weeks pregnant. She's bleeding currently. Is it normal?
Bleeding, number one, in pregnancy is not considered to be normal. And if we have to find out the cause. You might need to get an ultrasound done to find out what is the cause of the bleeding, and also rule out any kind of placental separation that is occurring, or if your placenta is low lying, we need to know. Bleeding during pregnancy should not be considered very normal or very likely. So I think you need to go and visit your doctor for this. If you're having like regular spotting, still you should consult your doctor to find out the cause first, and then manage according to the cause. If you're landing up into a threatened or preterm abortion or a miscarriage, or your cervical length is getting shortened, or your placenta is getting separated, we need to manage accordingly. If it is only a reassurance that is required, that also first we'll do an ultrasound and see what is the cause, and then only I would like to say it's normal. Reassurance is the treatment.
Thank you, Doctor. Jones Johnson, she has a question. 31 weeks pregnant, sugar levels higher in the body. Will it increase the itching throughout the body? And what is the cause for itching during pregnancy?
Her sugar levels are high. That is what you mentioned.
She's asking a question. She itching during pregnancy. What is the cause? Is sugar levels being high is the reason? What is the reason for itching during
in pregnancy can be because of many things. What is the reason for itching? Number one, I would like to order a liver function test for you to know what are your liver enzymes, that is AST, ALT, and ALP levels. There is a condition called as intrahepatic cholestasis of pregnancy. Short form is ICP, which is becoming very rampant these days in pregnancy. Almost 20 to 30% of women are having ICP these days. So I would like to rule out ICP in your condition if you're having a lot of itching on your body. Secondly, there are other causes of itching in pregnancy, that is pregnancy, PUPP, which is urticaria of pregnancy. Are you having any kind of rashes on your body, or any kind of pustules which are developing? Or it could be because of the rash, because of the clothes that are causing a lot of irritation. Wear cotton loose clothes, number one. Do your LFT levels. If your LFT levels are deranged, go and visit your obstetrician to rule out if it is because of ICP. Per se, high blood sugar levels do not cause itching. So this thing you should be assured of. And I just read the comment that she has in blood sugar levels of 103. Just with a single value, it's difficult to comment on anything, but high blood sugar levels do not usually cause itching. So ICP has to be ruled out. Just keep that in mind. Usually develops in third trimester of pregnancy itself.
Thank you so much, Doctor. Shanti's question, she's 28-week pregnant and diagnosed with gestational diabetes and advised to take 3 times the tablet Glycomet SR 500. Is it safe for the baby to take the tablet thrice a day?
Yeah, so Glycomet SR, it also contains Metformin. Initially only insulin was recommended during pregnancy a few years back. In the last few years, last 3-4 years, there have been many studies in pregnancy which say that Metformin is considered to be safe. In fact, I'll tell you a few benefits of Metformin during pregnancy. GDM patients who have a tendency to develop macrosomia or a low birth weight or IUGR or decreased blood supply through the placenta, Metformin curbs all these issues. Even after the baby is born, up to 1 year, 2 years of infancy, the long-term effects of diabetes which are seen in infancy, that is low IQ levels or attention deficit disorders or childhood obesities, in long-term studies, these things have been found to be reduced with Metformin. Metformin is considered to be a wonder drug, more so for patients who cannot do self-administration of insulin. It's very cumbersome to take insulin injections on daily basis for some patients. So Metformin has found to be really wonderful effects. You can take it, and your doctor is giving you 1500 milligrams a day, 500 thrice, so 1500 milligram, up to 2 grams, we consider it to be safe during pregnancy. It does cross the placenta and reach the baby to certain levels, but it has beneficial effects. So you should continue, as long as it is keeping your blood sugar levels normal, you should continue the medication.
Thank you so much for that reassuring answer, Doctor. Smithil is asking, when we usually start feeling baby movement, she's in 15th week of pregnancy.
15th week, okay. So it can vary for every pregnant woman. The ones who've had a pregnancy that is multiparous, the ones who've experienced carrying a baby inside the womb, they tend to have feel baby movements at an earlier gestation, around 18 to 20 weeks. the ones who are carrying the baby for the first time, because of the lower sensitivity towards the noticing the baby movements, they tend to experience a little later, maybe around 20 to 24 weeks of gestation. So just relax and enjoy your pregnancy. Just be happy till then.
Janav's question, doctor, she got rubella IgM positive in the blood test. What is it?
What is the period of gestation that this patient has? Rubella is a kind of a infection. It is a viral infection. So in TORCH test, which many people order, there are IgM antibodies and IgG, which we test. IgG shows that your body is resistant. You've already had an exposure to that particular infection. Your body has developed immunity. IgM shows that you have been exposed to that particular infection in the recent past. How recent, it's difficult to tell, but I would like to know what is your period of gestation right now, because this can have some implications. I'm 5 weeks. Okay, this is a different question. Mr. Ravi, could you, if this patient, if she can tell her POG right now?
Sorry, what is it?
I would like to know that patient's period of gestation, how many weeks pregnant?
She's 5 weeks pregnant, she mentioned. 5 weeks pregnant. The previous one.
Okay, yeah, patient with the rubella.
Yeah, this is a different question.
Well, then I'll answer this, but I want the previous patient to tell her gestational age.
Jainav, if you're watching this live, please mention your week of pregnancy. Doctor will be able to answer it better. So this is Clara's question about brown discharge.
So you're 5 weeks pregnant. Probably you might not even got an ultrasound done by now for pregnancy and around, because the heartbeat is usually visible around 6 weeks. So if you're having a brown discharge, you might not be so concerned. If it's a frank bleeding, then it is of concern. Slight brown discharge is normal during pregnancy, especially during this time. This could be because of the implantation. Like when the embryo gets implanted in the uterus, it erodes the uterus wall slightly. So there is a possibility that you might be experiencing this kind of brown discharge.
Pooja's question, 20 weeks pregnant. Today she had a scan and cervix length is 3 centimeters. Previous scan it was 3.3. Is it normal? Anything to concern about? Or can she travel through flight for 1 hour?
Okay. So number one, cervical length 3 centimeter alone. If I see, it's normal at 20 weeks of gestation. It's not considered short. Also, when was your last scan done? When it was 3.3. If it has shortened too early, बहुत जल्दी कम हो गया, then it might be that we need further monitoring in pregnancy. And a 20 weeks pregnancy with 3 centimeter cervical length, yes, you can travel. It's safe. What is the mode of travel that you're taking right now? Like, is it a flight or are you going by road, which has a lot of bumps? Then just
flight,
avoid that. In general, it's avoid in pregnancy if you're having a lot of bumps.
She's planning to travel by flight, she mentioned.
Yeah, it's safe. She can travel up to third trimester. You can take flights safely in pregnancy. Yeah. 18 weeks mein 3.3, she said.
So currently she's 20th week. It's been 3 weeks. Sorry, 2 weeks.
Okay. So 0.3 centimeter has come down in almost just 2 weeks. So that could be a little thing that we would want to monitor. Whenever you get your next ultrasound, this is not a short cervical length. I don't want it to create a lot of panic for you. But, and also I want to know your any previous history of losses. Did you have any kind of pregnancy losses in your previous pregnancy because of short cervical length? Like now I have a question, why the scan was done so early? Was it specifically to look for cervical length shortening, or you have a bad obstetric history previously? Then you need more stringent monitoring. Otherwise, 3 centimeter, we don't do anything right now. That can be considered as a normal thing.
Thank you, doctor. Revti's question, 35 weeks and she have diabetes and took insulin. Last checkup, they told 2 centimeter opened cervical line. Asked her to take bed rest. Is it possible to have a normal delivery?
Okay. See, number one, diabetes per se does not change the mode of delivery. But since your cervical length you have mentioned is just 2 centimeter open, that comes under short cervical length. bed rest is advisable, but also not a very strict bed rest. You should do a little bit of leg movements. See, there is one thing. If you with short cervical length, bed rest is advised if it is too premature. So you have crossed the level of prematurity, that is 34 weeks, but still we try to go up to 37 weeks in any case. Okay, and since your cervical length has opened by 2 centimeter, but I will not give you a strict bed rest, because there is a possibility of developing DVT also, because the blood gets clotted in the legs, which is also not very safe. So you should do little moderate levels of movement, not a lot, but you should do some kind of movements, not a very strict bed rest, number one, because you have already crossed the level of your prematurity of the baby. 34 weeks has been crossed. Your baby's lungs might already be mature enough. Also, since you're diabetic on insulin, I think your doctor might want to give you steroid injections for the lung maturity of the fetus, because in diabetes and pregnancy with diabetes on insulin, there is increased level of respiratory distress for the baby. So even if you're landing up in a premature delivery anytime in near future, your baby should have been prepared for this. Number one is steroids. Number one, not a complete strict bed rest to avoid DVT. Some active movements of the lower limbs is recommended. Even if you're lying down, just try to move your legs a little. That is one thing. And also, diabetes on insulin will not change your mode of delivery. And short cervical length with the diabetes is not an indication for cesarean section. If the cervix is opening itself, so that is a good sign that you might deliver normally. Then there's no point in going for a cesarean section anyways.
Thank you so much for that, doctor. Next question we take from Josna White. She's asking, she's 35 weeks pregnant. Is it okay to do exercise in the 9th month, especially squats?
See, squats, if you're doing without weights, is fine. People, the old age people usually would say कि third trimester में if you're doing mopping the floor, pocha laga rahe ho, that relaxes your pelvic floor muscles and helps in vaginal deliveries. Now this concept is coming back again. Beach mein, this was just getting lost. Now it's coming back again, especially if you go to UK. The people, the healthcare workers over there, the accouchers, they promote such kind of activities in third trimester. India mein people are still more scared, number one. Secondly, the pregnant women are even more pampered, especially in the third trimester, ki ye kaam mat karo, wo mat karo. It's not right. And squats, if you're doing, I would say that don't use weights at all. So squats, I think that should be fair enough in third trimester. If you feel any kind of, number one, very important instruction, if you're feeling any kind of contractions in your stomach, if you're feeling abdominal pain or a heaviness in your perineum while doing squats, or your condition is getting aggravated, then stop the squats. I don't even want you to end up in a premature delivery.
Shall we take one last question of the day, doctor? From hers, she's in 29th week of pregnancy. Sleeping on the right is more comfortable for her than on the left side. Is it okay?
Yeah, it's perfectly fine. Usually they say that you should avoid lying straight so that your good amount of blood reaches your baby. Supine hypotension syndrome avoid karne ke liye. So we usually recommend left lateral position as the ideal, because that is in that position the blood supply goes maximum to the baby. Uterus is slightly deviated to the right, and also जो हमारे blood vessels होते हैं उसके लिए ideally it's left lateral, but if you're comfortable with right lateral also it's fine. Its just main mechanism is to avoid any kind of decreased blood supply, that is supine hypotension to the baby and to the placenta. So right is fine with you.
Thank you so much for patiently answering all the questions in the last 30-35 minutes, doctor. Many people are thanking you so much for your wonderful answers. There are still some questions and more questions are popping, but we can't take, unfortunately.
Yeah, I think I tried to cover only GDM and pregnancy this time. Maybe we can keep a separate session for diabetes or any other topic, whichever you will recommend.
Yeah, absolutely. That will be very, very helpful. Thank you so much for your time again. We are looking forward to it. Thank you so much, everyone, for joining. And today's session is superb, amazing session with guided meditation. And I should say, compared to the usual days, we have lesser questions. The meditation effect is clearly seen. Thank you so much, Dr. Rachana ji, as well. And those are watching.
Questions related to meditation and maybe mental health, we can keep a separate session. And I would also like to know if the response is good enough, we can organize more of meditation sessions for the pregnant woman with Dr. Rachna ji. She's a wonderful person who guides you nicely into meditation sessions.
Cool. Sounds very interesting. So please, I mean, many of them, they are already following guided meditations, some advanced program, and we would love more and more sessions with Dr. Rachna ji. And interested people can sign up for some of her guided meditation programs as well. So please message us directly if you're interested. We'll definitely want to have a session.
Session for 3 days coming up. This is exclusively for pregnant women on 17th, 18th, 19th.
Wow.
Please DM us separately or personally so that we can help you more on this.
Yeah, amazing. So sorry, I'm not able to take further questions. So please post your questions inside the iMumz app in the feed section. One of our experts will definitely try to answer. We have been trying to answer all your questions so far. We answered more than 30,000 questions in the last 170 plus days with superb, amazing doctors like Dr. Aarti ji. So thank you so much, everyone. Subscribe to the Baby Care program. Check out all the benefits. There are more guided meditations, talk to baby exercises, baby bonding exercises for the whole family. Stay happy, stay healthy. We'll be back with another Ask Me Anything session tomorrow from 6 to 7 p.m. with Dr. Chitra ji. So stay tuned. And you can also ask questions tomorrow or today in the iMumz app. Once again, thank you so much, Dr. Aarti ji and Dr. Rachna ji for giving your time today and helping out thousands of pregnant women out there.
My pleasure.
Thank you, Dr. Rachna. Thank you.
Thank you so much. Have a great day, everyone.
Thank you, iMumz, for having us here.
Thank you, man.